So, hi ladies and gentlemen, my name's Wayne Cooper and today I'm happy to be here to give you a short presentation, it'll last about 10 minutes, on lower limb stress fractures. Now before we get started, I'd like to give you a handout. This will become apparent why we're going to use this in the next slide, just for a small activity. So I'm just going to give you all a handout. If you want to grab a pen out while you've got them handouts. And now we're just going to move on. So, first of all, I'd like to just do a little quiz. We're going to come back to this right at the end, and there'll be 2 points per each question. And I'd like you to identify the bone. So number 1 is marked by the black arrow. Number 2, the blue circle. Number 3 is the same picture, the red arrow. Number 4, the yellow flash. So I'd like you to try and be specific, proximal, distal, medial, lateral, and whether it's a left or right-sided bone as well. So like I said, there'll be a total of 8 points at the end, and we'll just see how you did. A bit of a refresher for your anatomy. So I'll just give you a few seconds to do that now, and we'll refer back to that at the end. So let's move on then. So the presentation I'm doing today, lower limb stress fractures, and what it's going to include then is an introduction, so why I picked stress fractures, because there is a reason why I did pick that subject, which type of athletes it affects, why. Also, we're going to look at diagnosis and why that's so important. And then we're naturally going to progress to move on then to treatment and management plan. And then at the end, we'll do a little summary of everything we've covered, and I'll give you a chance for any questions. On the question slide, there'll also be the references I've utilised for my research paper, but also I've added a few more just to enhance this presentation as well. So why did I pick stress fractures then? Well, in 1995 to 97, I'd been in the military about 8 years, and I was a physical training instructor, and we were seeing a lot of army recruits at the Army Training Regiment in Purbright in the United Kingdom who were suffering and had to be taken out of their recruit training due to lower limb stress fractures. So that initially sparked an interest in this subject. Then in 2002, I'd been trained for about 2 years now as a military exercise rehabilitation instructor. I was in Kosovo on a 6-month tour, and I was treating a lot of soldiers who were suffering from lower limb stress fractures. Now, something to know on tour, soldiers can be busy, but they can also have additional time on their hands away from their family to train, which can be a good thing, and it can be a bad thing as well if they're overtraining. And we'll touch on this a little bit later on one of the other slides. Also a point to note, some stats for you. Approximately 90% of all stress fractures are located in the lower limb. And as I was in the military for a long period of time, a lot of soldiers suffered from lower limb stress fractures, but injuries to the lower limbs. So that's why I thought I'd pick stress fractures for my research paper in the presentation today. So what is a stress fracture? Well, it's a hairline fracture or a small crack or swelling or bruising of a bone, and if left untreated or undiagnosed, it could lead to a full-blown fracture. Types of athletes that are prone to stress fractures. So you've got runners, people who are susceptible to impact activity, so sports people who are maybe participating in soccer, basketball, where there's a lot of jumping and landing, and also, as I've alluded to, military personnel like new recruits who maybe their training has increased dramatically over a short period of time. Also people who may be training for a marathon. So this is why. So people who are overtraining maybe. People, as I've just mentioned, might be training for a marathon. Also it could be the change in surface. So they could be going from running on a treadmill in the winter to now in the spring and summer going straight outside to running on the pavement. So a harder surface and more stress and strains going through the bones. Could be doing too much too soon, or they could just be adding another activity, a different activity to their training regime or training program, and that's why they're susceptible to stress fractures. So moving on to diagnosis then, and this is key to the entire management and recovery. Because if it's diagnosed correctly by a specialised physician who you have confidence in, then it's going to be able to be treated and managed correctly as well. So a thorough patient examination is key by a specialised physician, someone you trust, who's going to be able to diagnose a lower limb stress fracture correctly. They're going to be looking at the symptoms, any pain that you might be getting or discomfort, and then they're going to be asking you questions about the history and the onset to the injury. Have you started a new activity? Are you training specifically for something like a marathon, something like that? The reason I put MRI down here, so magnetic resonance imaging, is because that is also the gold standard to diagnosis of a stress fracture. There are other imaging methods, a bone scan, an X-ray as an example of a couple that you could go for if you believe you've got a stress fracture or the doctor believes you've got a stress fracture. But MRI is a gold standard because of the method it uses of imaging the desired structures it needs to diagnose a stress fracture. So treatment and management then, really key. If the injury's been diagnosed correctly, moving on to treatment and management. So it's important we try and find out and identify if there's any internal and external factors to start with. So things like runners, are they old? Do they fit correctly? Has all of their absorption factors still there, or are they too old and you need to buy a new set? Do you have flat feet or high arches? Because that again could be identified in the type of runners you might be wearing. Also your gait, another important factor, your biomechanical gait, and again you might need to have this diagnosed by a physiotherapist or someone like that who might be part of the treatment and management team if you've suffered from a stress fracture. Another factor as well is called female athlete triad. Now female athlete triad is susceptible in young ladies or girls, and it could be due to extremes in exercising or dieting or both, and it could then lead to 3 interrelated factors, 1 being eating disorders, 2 being menstrual dysfunction, and 3 being osteoporosis. Now with these 3 then would become a decrease in bone mass, which is then going to lead that lady or that young adolescent female to be more susceptible to stress fracture. And that's called female athlete triad. So there's some important internal external factors we need to consider. Moving on to conservative treatment then should consist of rest, ice compression, elevation, and anti-inflammatories to remove any inflammation. And then that's going to be 6 to 8 weeks. Could be a little bit shorter or a little bit longer, depending on the severity of your stress fracture, but about 6 to 8 weeks. And the doctor may also decide to put you in a protective boot or indeed put a cast on if it's an injury which is relative to the metatarsal, which might take longer to heal than, say, the tibia or the fibula. I've mentioned injury site-specific protocols because in one of the research papers, it really went into great depth. I generalised the research I did, so I wanted to mention that. One of the papers did go into great depth. It would be another 20 or 30 minute presentation on its own, so we won't be covering that today. And then finally on the treatment and management, gradual introduction to activity. So progressive and slow. In the conservative treatment, we can still do modified activity, maybe less impact or non-weight bearing or non-impact deep water jogging. And then when we then get to gradual introduction to activity, it needs to be progressive and slow so we don't make the person or the patient susceptible to getting that stress fracture back again. So just to summarise then what we've covered, diagnosis is key. Really important that it's diagnosed correctly, the lower limb stress fracture. And MRI is the gold standard in regards to imaging for stress fractures. Underlying issues, runners, gait, female athlete triad, dietary insufficiencies really need to be identified and rectified as well. And then we need to look at conservative treatment and rest and modified exercise. Gradual increase back into activity needs to be progressive and nice and slow. And the reason I put ongoing research here, because one of the papers did mention to help with persons or people who sustain lower limb stress fractures in the future, all ongoing research is only going to help to make the management and treatment plan and the diagnosis even more effective. This next slide, I decided to add. It wasn't included in the research papers, but I know the people who I'm giving this to today, you're all very active. I know some of you play hockey, soccer, you're into martial arts or basketball. So prevention is 10 times better than treatment and management. With prevention, we don't need treatment and management. This was taken from the American Academy of Orthopedic Surgeons, and this covered eating a healthy diet, so rich in calcium and vitamin C, to make sure the bones are nice and strong. Use proper equipment, so runners, make sure they fit properly, they're not too old, and they're determined by the foot type you have. Start new activity slowly, speaks for itself. Cross-train, really important. So if your activity is running and you do like to do other activities, well, maybe do a non-impact exercise like cross-trainers or bike or even deep water jogging. Add strength training to your workout. It's only going to make the bones stronger and strengthen the muscles as well. And if you do notice any symptoms that might be relative to lower limb stress fractures, or you've had them in the past and you feel them symptoms coming back, stop the activity and go and seek professional advice immediately. So I just thought that was really important to add that, especially to yourselves who are really active people. So just to finish off, these are the references I've used. Does anyone have any questions on anything we've covered? Awesome. So if you do, you can always contact me at a later date. Let's just move on to the final slide. So this is the answers to the quiz. So number 1, which was the midshaft of the second metatarsal of the right foot. 2 points for any one of those 3 points there. Number 2, the blue circle, distal end of the left fibula. So if you've got those two, give yourself 2 points. Number 3, proximal end of the left tibia and the medial aspect. Again, 2 points. And number 4, the superior aspect of the neck of the left femur. So out of a total of 8, if you can let me know how you did. Anyone get 8? Awesome. Well done there. And like I said, thanks for participation today. Thanks for listening. If anyone's got any further questions, please contact me. Thank you.